Welcome to Asheville Humane Society's Basic Care for Sick Kittens. The first skill we're going to go over is the burrito wrap. It's a basic technique that will make your medicating life much easier. The most important thing is to cover the kitten from above and wrap the towel around the front of the kitten's chest, covering its front legs and feet. It's important not to set the kitten on the towel and then wrap it around the kitten, but to make sure that you bring the towel over top of the kitten. Giving oral medications is the second skill. You'll use your basic burrito wrap and wrap the kitten from the top. You'll hold the kitten up close to you, have your medication already drawn up, and insert the syringe gently into the corner of the kitten's mouth. Then you want to inject the liquid slowly. This prevents the kitten from spitting it all back out onto you or from choking. It'll give them time to swallow the medication. Giving a kitten a pill is very similar, but it's all in the fingers. You want to open the lower jaw with your third finger and poke the pill down the kitten's throat with your pointer finger. You want to do it in one swift motion so that you don't get bit. Applying eye ointment and drops. You also use the burrito wrap. You only wrap enough of the kitten to where the kitten stays on the table and the towel comes in front of their chest to prevent them from scratching you with their front feet. You stand behind the kitten and tilt the kitten's head backwards, holding the kitten's lower jaw in your hand, using your thumb to pull the upper lid and the pinky finger of the hand holding the ointment to pull the lower lid down. And you insert about 1/4 of an inch directly into the eye. And you switch eyes and do the same with the other eye. Force feeding is very similar to giving oral medications. You again use your burrito wrap and hold the kitten close to you. Have your food in front of you and go ahead and drop your first syringe before you wrap the kitten. Gently insert it into the corner of the kitten's mouth and slowly inject it so they have time to swallow it. It's important to monitor the kitten's intake daily and at each feeding so that you can monitor how many milliliters of food the kitten is eating. You want it to at least stay the same day to day, if not increasing daily. Assess the body condition of sick kittens daily, sometimes twice a day if they're very young. You start with assessing the hydration of the kitten by doing a skin tint at their shoulder blades. You pull the skin up and ideally it should snap back into place. If it stands still, the kitten is dehydrated and should be seen for fluid therapy. You want the kitten to have a full belly. You don't want to feel any of the kitten's bones. If the kitten comes to you very skinny, it will take time for them to gain weight, so keep that in mind. You check their eyes daily to make sure that they're free of discharge. If you notice any discharge, you'll want to wipe them clean. Check their ears daily, just make sure that they're clean, especially if the kittens have been battling ear mites. You want to keep that debris wiped out daily. It's easy for kittens to get ulcers on their face and inside their mouth if they have upper respiratory infections. The nasal discharge, if it sits on their nose for more than a few hours, can start to irritate the skin, so you want to keep their noses clean. They can also get ulcers inside their mouth from hypersalivating. If you notice this, let the medical department know so that they can get you some soft food for the kitten to be eating. You want to check the kitten's rear end daily for matted hair and feces and monitor their stools in the litter box for any diarrhea. Cleaning a kitten can be a challenge. Healthy kittens clean themselves on their own. It's important to use your Burrito wrap when cleaning their face so you don't get scratched. A lot of times their faces are painful. Use a warm washcloth and wipe their eyes and nose clear multiple times daily. If they're really struggling with an upper respiratory infection, you'll want to wipe their faces clean as many times as you're holding them throughout the day. You don't want any buildup on their faces. You want to keep their rear end clean from any feces. Make sure their hair doesn't get matted. If their hair gets matted on their back ends, especially long-haired kittens can struggle with this, but short-haired kittens can too if they have diarrhea. Their back ends will get matted and it can actually prevent bowel movements from occurring, which can cause very serious issues. You'll want to use a warm washcloth and just wipe any feces off. The kitten in this video has a very perfectly clean bottom, and it's ideally what you would want your kittens to look like. Giving kittens a full body bath can be quite an experience. It's easiest with 2 people if you have them. You'll want to use warm water. You can use Dawn dish soap or aloe and oatmeal shampoo. It's best to check with the medical department or the foster coordinator to get you the correct shampoo. You never want to use flea or tick shampoo. Century or Hearts can be very dangerous. Anything over the counter that's medicated, you want to stay away from, just because we don't know what kind of reactions it might cause for that kitten. And you don't want to use any human shampoo on kittens. It's very strong and it'll strip their skin of the oils that they need. You hold the kitten gently but very securely. In the bath, you can soak them completely with the warm water or dip them into a bucket, making sure obviously that their face and their nose stays out of the water so that they don't inhale any. You can wash the kitten and then rinse it again by dipping it in the water a second time. And then the most important thing is when they are done with their bath is to keep them completely dry. You can use a hair dryer, but you want to make sure that you keep the hair dryer moving at all times and you don't sit still on one part of the kitten's body because it will burn them. The best thing is to put towels in a dryer and then use those warm towels when the kitten gets out of the bath to keep them warm. Most kittens that you're going to be bathing are probably very ill, so it's very, very important that they stay warm until they are completely dry. Fostering sick kittens can be very difficult, and we're very thankful for all of the volunteers that we have. Without you, we wouldn't be able to save as many lives, and we thank you very much for your dedication.